Hi everyone, my name is Dominique Carna. Everyone calls me Dom, which I prefer, so that would also be fine too. Just a little introduction about me, since we're all looking to kind of do intros and get to know each other a little bit better. I am a critical care RN. I work at Yukon Health in Farmington. I have been there for about 3 years or so now. It's been really great. I love it there. People are really nice. The facility is really nice. So I do work in step-down ICU. We do have a lot of sicker medicine patients, but mostly a lot of complex surgery, complex cardiology, and neurology patients as well. So it's been a really kind of nice mixed bag for me as a newer nurse to kind of build a skill set and get some good experience. So I've really enjoyed it over there. I do have a passion for precepting, mentorship, etc. So that's what prompted me to enroll in this program here at UHeart. And it's been really great so far. And I'm hoping when I'm done in the spring to be able to utilize this degree to work as maybe a clinical instructor or a nurse educator in some capacity. So I definitely am really excited for the opportunities that this will afford me. So definitely looking forward to that. I did go to school at University of St. Joseph's here in West Hartford on Farmington Ave. I graduated from the traditional 4-year program in 2020, so right in the height of COVID. So definitely, was an interesting way to be broken into nursing, especially in a critical care setting. But again, I think it provided, some nice experience, some nice opportunities for me to learn and develop my skill set. So yes, definitely an interesting past few years between that experience and starting a master's program. So that's a little bit about me. I do live in Berlin, Connecticut, so pretty local, nice spot for sure. I really enjoy this kind of Hartford County area, a lot of nice things to do, a lot of nice people up here. So it's been good. Yeah, that's a little bit about me. My EBP project, kind of segueing into that, like I said, I do have a passion for mentorship, precepting. So I did want to do my EBP project about that. I did notice during COVID, post-COVID, there was especially really a need for good, effective preceptorship. A lot of students who had, graduated as new grads were lacking some of that hands-on experience and really needed a little bit extra support, and that preceptorship role is super important. So that's really what sparked me to want to come up with an EBP project centered around enhancing preparedness to precept and mentor nurses. So my clinical question is in PIO format and is as follows. In nurses in an acute care hospital, will a mentorship educational intervention improve perceptions of preparedness for the nurse mentor role? So that will guide my EBP project. In the spring, I did do a pretty significant literature review through EBSCO Host to have some existing literature reviews, articles to support my EBP project and the need for it. So I definitely hope to expand on that this semester. My population will be my unit at UConn that I'll be giving these pre-post surveys as well as the educational intervention to. There's about 40 nurses on my unit, a lot of different levels of education, different years and backgrounds of experience. And we do have night and day shift RN, so I'm definitely hoping to get a nice diverse kind of group to respond to my EBP project for sure. I hope to start implementing it next week or the week after. I will be sending the pre and post surveys, which are Likert scale, 10 question evaluation tools, with my educational intervention through Outlook email, just because on a critical care floor, it is really busy sometimes. And I just want people to be able to sit down and look at it when they're really able to focus on it and give it the time it needs. So I'm hoping to send all of those evaluation tools and the educational intervention out next week or the week after to start implementing. And then I'm going to compare answers from pre and post surveys based on the effectiveness of the educational intervention for improving preparedness to precept and that will kind of give me my answer to my EBP project. I'm hoping to disseminate my findings through staff meetings again and again through an email through Outlook, just to make sure that everyone who was involved and, did participate in the EBP project can kind of have a follow-up to see what was found and how everything went with the project, because I know that my coworkers and colleagues are definitely really interested in it and they think it's a good topic. So I definitely want to make sure everyone gets a good follow-up. So yeah, that is my plan. If anyone has any suggestions, any questions, any feedback, that would be greatly appreciated, because I'm kind of still learning as I go, of course. I've never really done something like this before, so I could definitely use all the help I could get. But I'm certainly excited to finally implement this, because I know it's something we've been working on for a while in the spring. And I do think it is a really good topic. I think that, nurses on my floor who participate will be able to get some benefit from this, I hope. So yeah, I'm definitely looking forward to actually doing the implementation this semester, and I appreciate you guys listening. And if anyone has, like I said, any suggestions, definitely would look forward to hearing it. So thank you guys so much, and looking forward to a good fall semester. Thanks. Bye, guys.